Good evening. It's 7 o'clock and the Board of Health for the town of Reading is opening for the purposes of to host a public hearing to discuss proposed changes to a Board of Health regulation. I'm Carrie Dunell, I'm the chair for this evening, and do I have a motion to, so roll call, who's here?
Joan Wetzel here.
Kevin?
Jerry.
And our chair, Dr. Rick Lopez, is out of town, unfortunately, as is Paula Curran. Thanks, folks, for coming. If you haven't, there are 2 sign-in sheets at the door. One is just to sign in that you came to our meeting. The second is if you wish to provide testimony on the regulation. So if we're asking if you're going to provide testimony on the regulation, you please sign in and we'll use that to call names for people. If you just are here to observe, welcome, and you don't need to sign both sheets. Let's see, we are being recorded and broadcast live by RCTV. In addition, we're joined by by KBS TV from South Korea. From and so if you will be filmed, so if folks prefer not to appear on camera, there is an overflow room set up next door. You can hear and see the proceedings, and you just won't appear on camera. You'll be able to hear us if you wish to if you wish to provide testimony, and then you can come in and speak. So public hearing to discuss the proposed changes to the Board of Regulation restricting the sale of tobacco products. The agenda includes a QR code at the bottom, which actually includes the text of the regulation. For purposes of completeness, I'm gonna go ahead and read that. So the hearing is prohibition of sales. No person, firm, corporation, establishment, or agency shall sell tobacco or e-cigarette products to anyone born on or after January 2004. Any person, firm, corporation, establishment, or agency who or which shall violate any provisions of this regulation and upon written notification shall be fined and suspended in accordance with the schedule set forth under the regulation of the Reading Board of Health restricting the sale of tobacco products. This was, so it's included on the agenda, it's available on the town website. The purpose of our gathering tonight is to hear testimony from folks who are interested and have a position on the proposal. The board will not be engaging in any meeting together, we will not be doing any deliberating, and there will be no discussion. This is simply an opportunity for folks to make their voices heard. Once this meeting closes, we will meet again on June 10th, at which time we will deliberate and possibly vote about the regulation. So with the exception of Title V regulations, it's actually not legally required for the Board of Health to hold a public hearing on proposed regulations. But we choose to do so because of the broad interest in the control of tobacco and nicotine delivery products. And we appreciate folks coming to speak. It's an important part of the process to understand people's perspectives. And we definitely appreciate people taking the time to come and join us. Let's see. Okay, so I'm gonna invite the, I believe the select board is present and has a quorum, so I'm gonna invite them to call themselves to order.
I'll call the select board to order.
Thank you. And let's see, okay, we already did this. So I'm just gonna go over the ground rules. And this is about making sure it's for time. So we ask that everybody follow these rules. Anybody who wants to make comments, please sign in sheet right there at the table. We're only accepting testimony relative to the regulation, the proposed amendment to the regulation restricting sale of tobacco products. So please make sure that you are familiar with the proposed regulation and direct your comments toward that. We will not be answering questions or otherwise engaging in discussion or providing any response. We'll call you by name using the sign-in sheet. When you are called, please come up to the podium and identify yourself, but with name, your address, and if there's any applicable professional affiliation, please include that. We're asking people to limit their comments to 3 minutes so that everyone has an opportunity to speak. And we ask that please people be considerate of others when they're speaking, and allow for them to make their remarks whether you agree with them or not. Please no commenting out of turn. Thanks for the cooperation. Thanks for being here. Can I have a motion to open the public hearing?
Motion to open public hearing on May 23rd, 2024 at 7 p.m., which is thereafter. On the regulation of the Board of Health restricting the sale of tobacco products.
Second?
Second?
Second from Joan. Okay, all in favor? None opposed? Passes 4-0. Okay, so the hearing is open. And at this point, I'm going to invite, do we have, just the logistics, let's get the sign-in sheet. I know folks are still coming in to sign in, but, so let's get that first list and ask people to sign in and to come to the podium as they step themselves. Yes, yep, there's another sheet out there, so if you haven't signed in, you can use that. So first person is Stephen Helfer.
Hello. Do I get to see a timer?
I have it right here, you'll hear it if
Oh, here we go,
right here
okay.
for you.
My name is Stephen Helfer. I represent Cambridge Citizens for Smokers' Rights. I'm from Cambridge, Massachusetts. We are not affiliated with any business and make no money from tobacco. I think this proposal is always saying this is for children, but this will not affect children at all. This will affect adults only. Anyone born January 1st or after will be prohibited from buying tobacco, even when they're 30 or 40 years old. And I think it's strange because an 18-year-old will be able to obtain an abortion, undergo surgical sex change, die in the military, and be tried in a court of law as an adult. But he or she won't be able to buy a cigarette or a cigar or a nicotine product like a vaping machine. I think this is tobacco control out of control. And who is tobacco control? Tobacco control is a vast complex of government and non-government organizations who make their living on tax dollars and funding. And for them to justify their existence, they have to continuously create these crises that really do not exist. Why do I say there is not a crisis here? I'll say this. Anyone who does a very cursory internet search and goes to the two most authoritative surveys in the country, which is the Monitoring the Future survey by the University of Michigan and the government's own National Youth Tobacco Survey. Again, this is very available on the internet. Teen smoking is at a historic low. Teen vaping use has declined dramatically since pre-epidemic levels. Adult smoking is the lowest it's been and ever been recorded since 1945. It's about 12%, that's adult smoking. So where is the crisis? Why are we doing this for the children? Well, I'll tell you, I think this is actually misdirecting good public health intentions from where our young people are really suffering. We have, every year we set a new record for opioid deaths. This may not affect teenagers, but it affects 20 and 30-year-olds, some teenagers. Smoking deaths that are attributed to smoking, rightly or wrongly, occur to people after 40, 50, even 60 years of smoking. So this is, these opioid problem is much more pressing, and we should not be misdirected into harassing smokers and the businesses that depend on them from this problem. How much time do I have?
That was 3 minutes.
That was 3 minutes. Okay, I would just like you all to check out these surveys, the most authoritative surveys. I ask you not to pass this. It misdirects attention from what youth really need. It penalizes small, struggling businesses, and it deprives us adults of our freedom. Thank you.
Thank you, Mr. Helfer.
Thank you.
The next person on the list is Maureen Busby.
Good evening. Maureen Busby, 54 West Highland Avenue, Melrose, and Regional Tobacco Prevention Program Coordinator. We know the data about smoking-related disease and preventable premature death, and we know the heavy burden of healthcare costs related to tobacco use. We also know that boards of health have courageously led the way in tobacco prevention, and not just with tobacco sales regulations, but also with the state's smoke-free workplace law, which started in one community and spread to others and has been state law for 2 decades. It was groundbreaking at the time, but now we can't imagine going into a restaurant, theater, school, or hospital, or riding on a subway, bus, train, or plane where people are smoking. Local boards, including this one, were early adopters of T21, pharmacy ban, cigar minimum price, flavor restriction, permit cap, and more. Some of these regulations are now state law. Again, local boards recognizing their primary role in leading the way in important public health policy to protect their residents. But the tobacco industry is always one step ahead of us. From the cool, sleek Juul to vape pens disguised as highlighters, to nicotine pouches that are even more discreet, high in nicotine content, and made with nicotine salts for a quick hit to the brain. And these pouches are very, very cheap. A tin of Zyn has more nicotine than 2.5 packs of cigarettes, but costs about $5 compared to around $35 for the cigarette equivalent. But the most important information may be in a letter submitted by Erica McNamara, Director of the Reading Coalition. I believe you all have a copy of that in your packet. The NFG policy starts us on the path to a nicotine-free generation. Just as today's youth have never been in a public place in Massachusetts where people are smoking, youngsters of tomorrow will not be faced with products specifically designed to tempt them and trick them into starting a habit that can lead to lifelong addiction. Stoneham, Wakefield, Melrose, and Malden all recently adopted the NFG policy, becoming the first boards of health in the world to do so. The Brookline policy that you undoubtedly will hear about is actually a town bylaw. Thank you for your attention.
Thank you. Okay, and I know there's some folks that are coming a little late, just so I wanna make sure folks know there are additional seats in an overflow room next door. And if you do wish to, provide testimony, you need to sign in on both sheets. Okay, thanks. All right, next person is Lisa Stevens Goodnight.
Thank you. My name is Lisa Stevens Goodnight. I am the Tobacco Control Director for the Massachusetts Municipal Association, which represents the 351 cities and towns in Massachusetts. And as the Tobacco Control Director, I provide legal technical assistance on tobacco and nicotine control and policy development in cities and towns across the Commonwealth. Tobacco use remains the leading cause of preventable death in the United States, claiming the lives of more than 480,000 Americans annually due to smoking-related diseases. Despite decades of awareness about its adverse health effects, tobacco consumption persists, costing billions of dollars in healthcare expenses. Nearly all tobacco use begins during youth and young adulthood, and reducing youth access to nicotine products is of great public health importance. Local boards of health in Massachusetts have spearheaded effective tobacco-related health policies, such as the smoke-free workplace, which evolved from local initiatives to state law and has significantly reduced exposure to secondhand smoke in public spaces. Similarly, as Maureen mentioned, the prohibition on flavored vape products and raising the minimum sales age to 21 both began as local board of health regulations and are now state law. And local boards of health continue to develop innovative policies to reduce the public health cost of nicotine consumption. Nevertheless, the tobacco industry continually innovates, introducing new nicotine delivery systems, such as discrete vape pens and nicotine pouches, which undermine the effectiveness of existing regulations. The nicotine-free generation policy proposes a forward-thinking approach, which would reduce to tobacco prevention by introducing a birth date restriction in addition to the age restriction. It's a relatively straightforward measure. It simplifies enforcement for retailers who only need to remember one date rather than tracking the fluctuating minimum sales age. And importantly, individuals who have already attained the legal age of 21 retain their ability to purchase tobacco products. So over time, this policy gradually reduces the pool of potential new customers, but doesn't affect the existing pool. So in conclusion, the nicotine-free generation represents a proactive approach to tobacco prevention, addressing the evolving landscape of nicotine consumption while safeguarding public health and future generations. By implementing a birth date restriction alongside existing age regulations, this policy empowers communities to reduce tobacco-related harm and create environments to conduct healthier lifestyles. Thank you for your time.
Thank you. Next name on the list, Narcissa Christine Lyons.
Good evening, all. Sister Christine Lyons of Reading. The board's plan is to remove the choice of people born on January 1st, 2004 or later of whether or not they can buy tobacco in the town of Reading. While that is clearly a violation of our freedoms, it is also not legitimate. Members of the board were elected to serve the residents of this town, the best interests of this town, not create rules and regulations. That is not the board's right, nor is it any of our rights for that matter. A being's freedom of choice cannot be taken, whether it is a choice of one to buy a cigarette or to sell a vape, whatever. We have the right to decide for ourselves. We're born with that right, in fact, no matter when we were born or will be born. We also have the right to earn an income, and that income cannot be infringed upon for the sales of legal products. You, the board, were elected to help guide us to the healthiest decision, provide resources and education alternatives, not create regulations that limit our freedom just because you think people shouldn't smoke, that it's not healthy. It's a dirty habit, I agree, but that's beside the point. No one has the right, not you, not the state, not even at the federal level, regardless of what might be printed on illegitimate constitutions. You also cite Maslow's GLC 111 S31 and that it entitles you to make reasonable health regulations. But who decides what's reasonable? That right there is a separate panel or meeting. And this to me is clearly not reasonable. It's never reasonable to rob any sovereign of a God-given right, and to dissect it to a portion of the population is prejudicial and divisive. Also, it is never reasonable to try to diminish a man's right to earn a living. Tobacco products are a large portion of the cash flow from our convenience and liquor stores. This move would undermine them while preventing nothing for health problems. People of the less free class you are trying to create would just go to another town or another state eventually if this creepy mentality spreads. To that point, please don't say, well, Wakefield's doing it, Stoneham's doing it, or thinking about it. It's a weak fallback that has nothing to do with anything. Let Reading set an example of making the right choice ourselves and giving us harmony and freedoms in our businesses. Mimicking other towns is a sign of not being capable of making the right choice ourselves, and other towns make mistakes all the time. I have now given you closure on what the board can and can't do, what should and shouldn't do. I hope you choose the correct path. Thank you.
Thank you. Last, thank you. Okay. Next name is Jody Roffey.
Hi, my name is Jody Roffey, 21 Bainbridge Road in Reading. I didn't write anything because this is coming from my heart. I am not a smoker. I read your entire proposal. I recognize that the restrictions that have been put on tobacco for minors has really helped. I grew up in a generation of smoking everywhere, and just with education and prevention of minors, it is, like the gentleman said, way down. But what I'm objecting to is anyone over the age of 21 in the town of Reading being restricted from buying tobacco products. I don't see the advantage. I don't want my freedoms taken away from me. The next thing will be donuts, because fat people have high blood pressure and diabetes. Or perhaps it will be alcohol. We're gonna be a dry town, because alcohol is just as bad. So once you start this slippery slope, and I don't like that phrase slippery slope because everyone uses it, but this is a fact. It's time for us to use the funds and the intelligence and the time that you people are offering to our community to educate young people, not people over 21 who have the right, the God-given right in our country to make those choices. The next thing you'll be telling me is I can't buy Dunkin' Donuts. What is this? Where do you get the right to do that? Yes, it's bad to smoke. I don't smoke. No one in my family smokes. I don't want my grandchildren smoking. But I want anyone over 21 to have the right to do that because at 21, you can smoke marijuana now. There's so many things you can do. You can go to war and donate your life, but you can't buy a pack of cigarettes. I hope that you'll make the correct choice and remember that it's over 21. That's the problem with this. It's not educating, restricting. It's the fact that anyone over 21 would lose those rights.
Thank you. Okay, next up is Maddie Baldock.
Hello, Reading. I am Maddie Baldock, a junior at Melrose High School. So 2 years ago, we sadly lost my grandfather due to lung cancer from his excessive smoking addiction. Growing up, I always remembered riding in his big pickup truck that reeked of cigarettes. In second grade, we learned about secondhand smoking in health class, and all I could think about was how much secondhand smoking I was inhaling while in his car. I would always try and hold my breath or stick my head out the window in search of clean air. My grandmother also lived with me at the time, who was also a big smoker. I hated her smoking so much that me and my younger sister hid her cigarettes behind the couch one day. To make a long story short, would not recommend. To this day, she still smokes cigarettes even though her lungs are starting to seriously deteriorate, and she can barely go up the stairs without getting winded. Over 500,000 people die each year because of smoking just in the US, not to mention the cause it has on the greenhouse effect. By banning the sales of tobacco products, we are not only saving people's lives, but also the environment. Thank you.
Good job, thank you.
Thank you. Next up is Daniel Dewar. I hope I'm saying names right. I apologize if I'm not. Sorry?
Which doesn't get banned.
Okay.
My name is Daniel Dewar. I'm the former owner of the Reading Quick Stop, a standalone convenience store, the last one in Reading. All the other convenience stores are attached to gas stations or pharmacies. I've been up here, I actually just sold it in the last year. However, I am passionate about this issue. I've been up here, this is my third or fourth time, every time they make a new regulation. And it just doesn't make sense to me. They've done a good job, Maureen and her gang have done a good job of getting the youth off of this, but now you're going after adults. I think it does make no sense, no earthly sense. I just can't believe other towns have actually even adopted this. It just blows my mind. I've asked every time, why don't you go after the liquor stores or after caffeine, Dunkin' Donuts, or any of the other stuff? Never ever do. I never got an answer, and I've never seen any action taken towards that. It's always a convenience store selling a nicotine product. And they went up to, from 18 to 21, they took flavors off our shelves, even though you can go to the liquor store and get flavored vodka, flavored rum, bubble gum, raspberry, all that stuff. In past Board of Health meetings, they claimed it was marketed to kids. They showed cartoons, but I can go into a liquor store and see the Captain Morgan guy sitting on a rum barrel. I mean, that's marketed to kids too, if you want to make the same analogy. So I don't think that it is a good proposal for a nicotine-free generation. It just doesn't, it makes no sense. I mean, I don't know what more to say. I mean, thank you for your time, and I hope you guys make the right decision, because I think this is a terrible, terrible road to go down.
Thank you, Mr. Dewar. Okay, next up is Erica McNamara.
Hi, my name is Erica McNamara. I'm the Director of the Reading Coalition for Prevention Support at the Police Department, 15 Union Street in Reading. I wrote a letter to the board on behalf of our coalition staff, mainly to provide context on what we are already doing for nicotine education and prevention, so that the board has an idea of what's already happening in the context of the work that's been going on for the last 16 years. I wanted to provide some data from the latest Youth Risk Behavior Survey from our Reading Public Schools on nicotine usage. We had 77% of our local students in grades 6 through 12 take part in the survey administered by the Reading Public Schools and JSI Consulting. Students were asked the substances they used in the past 30 days. 10% of our high school students in Reading reported currently using e-vapor products, and 2% reportedly currently smoking cigarettes. For middle school students, 8% reported current use of vapor product and 1% current cigarette use. More than half of local high school students were most likely to think vaping products were easy or very easy to access at a rate of 52%, while 29% of local high school students were most likely to think cigarettes were easy or very easy to access. There is a difference in young people's perception of access to vapes versus cigarettes. Middle and high school students were also given the opportunity on the survey to identify the health issue they felt concerned students in their school. 16% of students identified vaping as the concerning health issue for their peers. The coalition and school resource officers provide education on nicotine prevention at the middle and high schools in Reading. Reading Public School educators also tackle this important subject in health classes at the elementary, middle, and high school levels. The coalition and school nurses administer the SBIRT verbal screening, which is a state requirement. We do verbal substance misuse screenings, including questioning on nicotine usage. In 2023, 7% of our 10th graders that were screened reported misuse of nicotine, and half of those students struggled with quitting that substance. The coalition also operates the chemical health education program for the Reading Public Schools. We processed 12 vaping violations involving students this year. Students were provided an education class and referral to services. According to our outreach coordinator that works directly with our students that are impacted by vaping continue to be unaware of the damage of nicotine on their brain and bodies. We try to assist, but many students are already dependent on the substance. Students that receive a second violation are automatically referred to their primary care provider for an evaluation recommendation for further support. We implemented this requirement 10 years ago because we found that students were using a higher amount of nicotine and did require medications to taper off the substance they were using. The damage to the body from vaping does progress more rapidly, and a medical professional is the best resource for providing guidance to their parents. We also assess students who receive beyond a second violation for nicotine dependence. Lastly, we see young people misusing nicotine products, including vapes and ZYNs, regularly. At the regional and state level, we are facing similar challenges. The EVALI diagnosis emerged prior to the pandemic, and we had 18% of the 2,600 people that were hospitalized were under the age of 18. I'll close with just reminding you that the letter is there with additional information, and I thank you for your time.
Thank you. Next person is Kate Silva.
Hi, thank you. I'm Kate Silva, 60 Amory Street, Brookline. I'm the co-sponsor of this same regulation in Brookline in 2020. Once you have become an adult, you still don't have a right to buy everything you might want. Adults can't buy asbestos, for example. Adults can't buy lead paint. Smoking has caused more harm than either of these. It is unique. It is the #1 cause of preventable death. It is singular. Why can we still buy a product that's the #1 cause of preventable death, implicated in 1 in 5 deaths, and will kill nearly 1/2 of its users? Why not go the way of asbestos and lead paint? The first answer has to do with addiction, and I think other people will speak to that. But the second is that nicotine is a really lucrative business. Now, that's not enough to justify the harm it causes, but still, tobacco phase-out is not costless to the industry. So can we consider this 60 years after the Surgeon General first warned about the dangers of tobacco? What is the least painful way to manage the wind down for businesses? The answer is this reform. It is the birth date restriction. It is a slow phase out. Not one single current buyer is lost to a retailer, not one. It's just that no new ones will age into being able to purchase. As a phase out, this is literally as incremental and gradual for the retailer as possible. Some people worry about a black market. This birthday restriction is elegantly designed to escape a black market issues that would come with a complete prohibition. And that's because you need users who want a substance and can't get it in order to create a black market. But if no new users are created, there's no need for a black market, but meanwhile, those who have currently using can continue to have access to the product legally. And that's why this reform avoids a black market. I just want to close with the words of Margaret Mead. Never doubt that a small group of thoughtful and committed individuals can change the world. In fact, it's the only thing that ever has. Thank you.
Thank you. And I just want to pause for a moment to recognize Chairman Bocci is here. So the select board was called to order.
Yeah, someone did
so-
already. Let me see, was
Yeah.
it someone already did? Okay,
Yes.
sorry.
No, you're fine, just, yes, you are, so, welcome, okay. And for new folks, there's an overflow room if you want, you don't have to sit on the floor, you can hear everything, and welcome. Okay, next person is Mark Gottlieb.
Good evening, I'm Mark Gottlieb. I'm the Executive Director of the Public Health Advocacy Institute at Northeastern University School of Law. And about a little more than 10 years ago, my esteemed colleague, Professor Richard Daynard, published a piece in the New York Times that introduced this policy to the general public, a policy to end the cycle of addiction and long-term chronic tobacco use, starting with the next generation, and also doing it in a way that, as Professor Silva just mentioned, does not result in the loss of a single current customer to retailers. So our institute offered to defend any legal challenge that would emerge should a city or town in Massachusetts take this policy on, and Brookline was the first in the world to do so, and then became the first in the U.S. to be sued for doing so in late 2021. And my colleagues and I had the honor of defending the town pro bono to the Supreme Judicial Court, which, as I'm sure you're aware, on March 8th of this year, affirmed the dismissal of that lawsuit and found that there was no conflict with any state law and no constitutional violation in this policy. And that basically has cleared any legal hurdles that may exist, but if there are any other legal challenges that would emerge, we stand ready to assist and defend any city or town in the Commonwealth. This is a policy that over time will change the gap in age from those who, I should back up a second, just say, most young people who are getting tobacco products are getting them from older peers. And this will increase the age gap between high school students and middle school students and older peers over time, such that at a certain point, they're not going to have peers that are under the age of 30 to get this stuff from. And so I think it's going to actually have a real a benefit for underage kids in the Commonwealth, not just a new generation of non-tobacco users and those who aren't addicted to tobacco products. I hope you'll support this. I guess we have 6 jurisdictions now that have passed this policy. And I think it is really the beginning of a new wave of public health measures through Massachusetts and hopefully throughout the world. Thank you.
Thank you. Next name is Chuck DeAndrea. And again, if I'm not saying it properly, please correct me. DeAndrea?
DeAndrea.
DeAndrea. Welcome.
My name's Chuck DeAndrea. I live in Reading. I've been here for 32 years. I've been a tobacco salesman for 42 years. And I've seen it all and everything. You're my hero.
Oh, thank you
You're
very
my
much.
hero.
Thank you very much.
Cigarette smoking isn't good for you. Absolutely. But having a right is the best thing we could possibly have. See those people on the wall over there? They enforce the law. They gave us rights, okay? And although cigarette smoking is bad, so is it marijuana. So is it gambling. And the fool that runs our country just wanted to decriminalize marijuana. Isn't that nice? That's great. And we're here today saying that a 50-year-old or a 40-year-old or a 30-year-old is not gonna be able to have a cigar or a cigarette one day. Like this lady said, someday you're gonna walk into Reading Quick Stop, you're gonna say to you want a pack of Twinkies? Look it on the scale. No, your body weight, you're too fat. We can't sell it to you because you're taking a right away. Nobody's ever died, not one person has ever died from secondhand smoke, that's number one. Not in Korea, but in China, 2 out of every 3 people smoke. In Italy, there isn't even an age limit to drink. Talking to you in the third person, mind your own business. Watch your own house. Watch your own kids. Police your kids. And why are you policing them about cigarettes? Police them about the casino that's down the street. Police them about the marijuana plant that just got, the marijuana dispensary that's 3 miles from here. Teach them about that, about marijuana being decriminalized. Teach it in the home, teach it in the school. Don't take it away from a 21-year-old person that can die, that can have an abortion, that can pay taxes. And be careful what you wish for, because the people that don't smoke, the cities and towns and states are losing revenue. And when they lose revenue, they need something else to make up that revenue. And they're gonna come after the people that don't smoke. And your taxes are gonna go higher than they are today. That's all I'm saying. Cigarette smoking's no good. I'm 65 years old. I've been selling cigarettes since I was 30, less than 30, 25. I don't know how to light a cigarette. I never smoked a joint in my life. And I don't drink. And I came from a single parent, a single mother that brought me up and told me what was right and told me what was wrong. But I still had the ability to make my own decision. I could have gone down the right road and I didn't. A lot of people have a mother and a father. Work together, police them, smell their clothes. Who are they hanging around with? Where are they getting the money for this? Very simple. There's plenty of problems in this world. There's plenty of things that are gonna entice them. Cigarette smoking, it's a thing of the past. It's blasé now. It's going down, as you can see. The world is on fire. Mind your own house and watch your own kids.
Next person is Nancy Doctor.
Thank you very much for coming. Nancy Doctor, Pearl Street, and a Precinct 1 meeting member. I've sent my written statement in, so I'm not going to repeat a lot of the data. I'll elaborate more on why I'm supporting this amendment both personally and professionally. Professionally, as a nurse, I've taken care of people who have suffered from serious medical complications from their tobacco use. As a clinical specialist now, I treat addictions. And I will tell you, one of the things we tell people who are dealing with addictions is you'll be much more successful in terms of relapse if you give up smoking at the same time. Because cigarettes light up the same part of your brain. So statistically, if you're treating anyone with any addiction, particularly opioids, we encourage them to stop smoking at the same time. Personally, both my parents have died from tobacco-related deaths. Now, my father was an MD DDS. He was a reconstructive plastic surgeon. He knew better. I used to, in summers, take the pre and post pictures of his patients. The one that really stands out for me was the farmer from the Upper Peninsula who lost part of his jaw from chew. My father knew better, but he didn't quit. My mother had her first heart attack in her 50s. Anyone in healthcare knows that's pretty early for a woman to have a heart attack. She didn't quit smoking. She quit smoking when she was diagnosed with lung cancer and they removed part of her lobe. Now, on her death certificate, it said she died from congestive heart failure, but we all know she died from cigarette smoking. Both my parents died from their addiction. So I applaud this body for your reforms back in 2016 that didn't close any businesses, by the way, when you banned flavored tobacco. And I applaud your attempts to do this now. Because this is something that actually is worth kind of getting behind. I do believe the idea of you passing this, along with the fact that other areas, communities that pass this, is how to be successful. I spoke last week to a retired ATF agent who said, short of a state ban, this is the best solution. Support your local communities who are in putting this ban in effect. That is the way to be successful. So I urge you to support this, and I really appreciate your work on this. Thank you.
Thank you. Next person is David Ajemian.
I'm gonna pass.
Okay. Thank you. So then that brings up John Sasso.
Thank you, John Sasso, 66 Richards Road here in Reading. I guess just for background, I don't smoke. I think it's a dirty habit. Been very lucky over the years to see some of the changes in the landscape to improve our health, and I do appreciate that. But I am adamantly opposed to unelected officials making rules to take rights away from people. If the country wants to decide to get rid of tobacco, then great, let that happen. But unless that place occurs, I happen to believe this is not a rule or a regulation that should be provided by the Board of Health. If you want to continue the efforts of education and smoking cessation and get grants, I'm all for that. But I don't believe this is a role that you should be taking. Where does it end? I mean, someone mentioned the slippery slope. I'm very much afraid of that. I mean, how far do we go? Do we go to the point of where we say, well, we're gonna make sure that the illegal immigration issue that we're having in the country today, let's take action locally and not allow anybody in the city because they're an illegal alien, because they're bringing mumps and measles and all sorts of other things there. I don't believe this type of a regulation is something that this board has the purview for, regardless of what folks may have said from a legal perspective. I don't approve of it, and I hope you don't support it. Thank you very much.
I appreciate the analogies. I'm just gonna remind folks to confine their remarks to the regulation specifically. Thank you. The next name is, I think, Kate Halloran? Heffron. Sorry.
Hi, my name is Katie Heffron. I'm a resident here in Reading. And tobacco is the only consumer product when used as directed kills you. And I am a mom. I have three kids. And I grew up in the 90s. And when I was a kid, when we went out to dinner, there was a smoking section and a non-smoking section. Now, as a mom taking my kids out, I can't even imagine people smoking cigarettes in a restaurant. And I think that this type of regulation is very similar to the smoke-free workplace back in the 90s. It's met with a lot of conflict, met with a lot of questioning, met with a lot of how far is this going to go. But I think that the huge reduction that we've seen in adult smoking and in youth smoking has come from local boards of health like you folks that have put policies into place that have highlighted the dangers of smoking and that have taken it out of the public in public areas for people that don't smoke. And, you know, I lost both of my grandparents to smoking related diseases. My grandmother was 56. I think that hopefully my kids are 5 and 3 and not here yet, but I'm hopeful that tobacco use, specifically cigarette use, will be obsolete likely once they're old enough to be tempted to start smoking or for it to be relevant in their circles of friends or, and I think that this type of regulation where it cuts it off in 2004, I think that is another step closer to making a, tobacco-free generation for my kids and kids to come. Thank you.
Thank you.
Thank you.
Next person is Kathleen O'Leary.
Kathleen O'Leary at 81 Middlesex Avenue. Thank you for having us tonight. I'm going to take the perspective on the clinical end. I'm a nurse practitioner, family nurse practitioner of 30 years. Past 13 years, I've been practicing tobacco treatment and been certified from UMass Medical School in tobacco treatment, which means I treat patients with the addiction or nicotine dependence. Just a little background about nicotine. I think we hit on some statistics. 480,000 people die of smoking-related illness in this country annually, and 41,000 die of secondhand smoke. We have had some regulation and restriction of cigarettes, which has helped lower the rate of cigarette use. But we've seen a rise in vaping products, smokeless. In my practice, what I do is I provide research-based tools to help people with the behavior of their nicotine dependence and help them quit. The other side is the physical side. We're all born with nicotine receptors. The more we smoke or chew tobacco or use nicotine products, we build more receptors. I have seen this in my practice. I treat youth to adults. I used to just see cigarette users, and I now see vaping or cigarette and vaping users. That's dual users. And now I'm seeing more youth than adults triple using cigarette, vape, and Zyn, which is smokeless product. This increases the need for the body and mind to have nicotine products. We can treat it. We can treat the physical end with nicotine replacement products such as patches, gum, lozenge, Nicotrol inhaler nasal spray, and Chantix and Wellbutrin. We can treat the behavioral side with tobacco treatment counseling. If we approach it, two-prong approach, treat both of those sides at the same time, we have greater success. Unfortunately, it's not a 100% guarantee. The average American takes 10 quit attempts on average to quit a nicotine product and quit it for good. It's an average, 2 for some, 20 for others. And nicotine use in this country, on average, the average age is age 8. 8 years old, when the brain is developing, grabbing onto that nicotine, building receptors. As people get older, it gets harder to quit. It's an arduous task. So please consider this on your decision. Thank you.
Thank you. Okay, 2, 3, 4, 5. Okay, so we have 10 names remaining on the list. The next person is Anthony Ishak.
Good evening. Hi, I'm Anthony Ishak. I'm a pharmacist at a local medical system, and I work in adult primary care, taking care of people with diabetes and high-risk cardiovascular disease. I also live in the town of Brookline, and I was a co-sponsor along with Kate Silva on this fairly new and novel idea to help with tobacco addiction. Everyone has already mentioned that tobacco is toxic to our health. I'm not going to go into much of the details in terms of broad use, but I want to highlight one particular thing that came across in the last couple of weeks. So I work in a teaching institution, and obviously it means we teach healthcare providers who are coming through. There was an updated guideline on peripheral vascular disease, which in the US is the #1 cause of preventable amputations. The biggest risk factor for peripheral vascular disease is tobacco smoking. We think about cancer, we think about lung disease, but there are many pervasive illnesses that tobacco just puts its fingers into. Smokers are more than twice as likely to develop peripheral vascular disease. Tobacco addiction is important for all of us. We all pay the price of it. Reducing addiction in our state by 1% would reduce costs to our budget, for a significant portion of our budget, which is healthcare, by $70 million in the first year. That amount of money could go towards our schools, towards our roads, and towards numerous other things. In fact, helping with small businesses run by many of our residents in this town. We all pay the burden through our health insurance costs and our taxes. No money comes back to the town from tobacco, it goes to the state. Just who is at risk of addiction? 93% of smokers don't have a college degree. 18% of low-income households have a tobacco user. Adults with disabilities are nearly a twofold risk. 28% of those experiencing a psychological distress episode, tobacco is involved. 90% tried their cigarette under the age of 18. It's not an adult choice. This isn't a habit. It's not like spitting on the sidewalk. It's an addiction. Tobacco finds ways to target a common theme, vulnerable groups. Although we think it's a choice, it isn't. 68% of adult smokers want to quit, 55% try to quit, 7% are successful, 1 in 14. One of those 14 was my father. Took 2 heart surgeries, and my then 11-year-old sibling brother, not willing to be around him with his asthma, for my father to finally quit smoking. By enacting public policies that punish wealthy tobacco companies who are continuously trying to find ways to innovate addiction, such as when they came out with flavored products prior to the pandemic, if I could just have a few more seconds, sorry. We have continuously had to respond with innovative solutions. We banned flavored, and then we saw the numbers in youth go back down to pre-pandemic levels. This is an innovative solution. It's a rational step to help people who are vulnerable to tobacco companies' preying actions. Tobacco companies continuously innovate to get people addicted. This is an innovative solution. I'm here as a healthcare provider and as a resident of the state, although I don't live in Reading, but I beg that you keep this momentum going by voting in favor of a proposed policy rather than citing the tobacco. Thank you again for your time.
Thank you. Next name on my list is Chris Haley, please.
Thank you, Chris Haley, 71 Tennyson Road. I'll preface this with that I'm not a smoker. I've never smoked a cigarette in my life. I have asthma, secondhand smoke is very bad for me, etc. But still, I'm here today. I have 2 videos that I just wanted to play. You don't have to see them, you just have to hear them. And I assure you there is a point at the end. So if I could just start that off.
Happy birthday to you. Happy birthday, dear Autumn. Happy birthday to you. Yay! Make a wish. I don't even make mine. Yay!
Autumn, what did you wish for?
I can't tell. I can't tell. Oh, it's the same thing you've been wishing for forever. I referred you learn to stop smoking.
That's right. Why do you wish Kellogg?
So she can come to my wedding.
My sister started smoking before she was legally allowed to. Someday it is going to kill her. I'm well aware of that. But just like Maddie from Melrose, who just left, and then both of my girls, they won't be smoking. I guarantee it. But the difference is, that's their decision, and it's not yours. Thank you.
Okay, next up is Emmy Dove.
Emmy Dove, Charles Street. So I think there's an interesting cognitive dissonance going on in our perception of opioids versus tobacco. I think there's pretty unanimous consent that the public health community should be doing stuff about the opioid crisis, harm reduction, limiting access, et cetera. But we don't seem to have the same drive with tobacco. And the numbers just don't support that. So in 2022, there are 80,000 deaths due to opioids. Meanwhile, as you've already heard, cigarette smoking is the leading cause of preventable death in the US, causing 480,000 deaths a year. That's more than the deaths caused by HIV, illicit drug use, alcohol use, car accidents, and firearms combined. When you look at the economic picture, the US a few years ago had spent $35 billion in that year on healthcare costs associated with opioid use. We spend $240 billion a year on healthcare costs associated with tobacco use. In Massachusetts, that would equate to roughly $1,100 per household per year. When we look at lost productivity due to illness, $24 billion for opioids, $185 billion for cigarette smoking. For lost productivity due to premature death, $69 billion for opioids, $180 billion for premature for cigarette smoking, and then an additional $7 billion from premature death due to secondhand smoke exposure. Yet somehow tobacco is socially acceptable. I don't really
I can
understand.
ask folks to, excuse me one second, if I can just ask folks to keep their voices down whilst respectful, others were respectful for their testimony as well. Thanks.
So, on a personal note, when my uncle was 42, he was diagnosed with advanced lung cancer. My parents became his caregivers, and he spent a lot of time in our home. And if you've never seen somebody die from lung cancer, it's a really horrifying experience. It spread to his bones and his brain. It was awful. We're all left with residual trauma from it. So a year and a half ago, when my father was diagnosed with lung cancer, it stirred up a lot of feelings and worries. He was very lucky because it was an incidental finding on a scan. So they caught it exceptionally early. This typically does not happen. And so what really fortunate looks like is he had to drive from 2 states away to Boston to have an entire lobe of his lung removed. There were complications and it was a very difficult recovery. And he'll never physically be back to where he was before the procedure. And now he has that shadow hanging over him every time he goes for a follow-up scan. And anyone who's ever had cancer or has been close to somebody who has cancer knows what I'm talking about. Tobacco has absolutely no redeeming value, and I fully support this amendment.
Thank you. Next person is Aiden Wang. Saying it right. Aiden.
Maybe they're in the next room.
In the other room. Come on up to the podium. Thank you.
Do I have to state my?
You can do your name, your address, and if you work for anyone that is related to this.
My name is Aiden Huang, and I'm a member of the Mystic Valley Public Health Coalition, and Reading is one of the members of that. I'm not from Reading, but I'm from Winchester. I'd like to just start by saying that according to the 2021 YRBS data, 31% of high schoolers reported using an electronic vape product. That's almost 1/3. Even though technically nicotine use under the age of 21 is illegal, the laws we currently have certainly are not keeping the youth away from these products. Underage use is so normalized in high school that we sometimes forget that it's even illegal due to the lack of restrictions, strict restrictions. Nicotine use is so prevalent in the youth that it's almost always used as an unhealthy coping mechanism. According to the same 2021 YRBS data, almost 20% of youth under the age of 21 currently use electronic vape products. This can get people on the wrong track. For instance, my friend was going through a toxic breakup, and she resorted to using vaping as a coping mechanism. And previous speakers have explained how vapes and other nicotine products can be concealed in highlighters and other small products. And even as a friend, it can be hard to tell if they're using a vape product, and I can't even help them because they can be at home behind closed doors using that. And it's really detrimental to not just her schoolwork, her social life, and other aspects too. And it can be painful to see that from a third person perspective. New products are also being a lot easier to conceal, like anything before, and it just keeps making youth more addicted. It seems like a cool thing on the street, but it actually isn't. And our laws today are clearly not working. This is why we're here talking about this nicotine-free generation policy. And so more extreme measures have to be taken in order to address this problem, and the only way to solve it is to remove it. Therefore, I am highly in support of the Nicotine-Free Generation Act. Thank you.
Thank you. Next person is Meher Sharawat. Please correct me. Come on up to the podium.
Hi, my name is Meher. I'm from the Mystic Valley Public Health Coalition. I'm not a resident of Reading, but I'm from Winchester. Hi everybody. So I just want to start by saying that vaping has become so normalized, it's hard to even remember that it's illegal. As a teen, everyone around us is using substances. There's literally no avoiding it. I was at a local dock today with my friends swimming, and I was like, what does that smell? And sure enough, right across the dock, this is a fully true story, like 2 hours ago, there was 4 kids, couldn't have been above the age of 15, like vaping. Last week, I'm a member of the Winchester School Committee. I took a trip to the State House, and I was talking to some kids from Medford, and I was asking them, like, what's the drug problem like in Medford? And they said, it's everywhere. We don't know what to do. Like, you walk into the bathroom and there's kids like vaping, and it's just like, and I was like, do teachers do anything? Like, does administration do anything? They don't know what to do. Like, it's everywhere. Like, they don't know how to stop it. And as teenagers, we're especially susceptible to this, like, wanting to fit in. And in the case of many of today's youth, unfortunately, that means vaping. One student getting their hands on a vape doesn't mean just that one student is vaping, because that has a domino effect on their friends, on their peers, on the people around them. And more students are engaging with nicotine products every day. Nicotine has been illegal for years, and it's clearly not doing anything. I mean, it's just getting easier and easier to access these products. As of 2019 in Massachusetts, more than 50% of teens reported having used an e-cigarette problem at least once, and that number literally rises daily as vapes become more prevalent in social circles and in the media. Once one person gets addicted to these products, whether they were peer pressured into it or they were trying to be quote-unquote cool, it's incredibly hard to end such an addiction, and this can have lasting effects, and it can really be detrimental to the success of our youth. This policy is truly not a detriment to convenience stores at the moment. I hear the other side of this argument, I do. Because this policy is based on birth year, it will take quite a long time for convenience stores to lose all their tobacco and nicotine sales. Any sales that they're losing right now are coming from young people that shouldn't have even been buying in the first place. This gives them time to adapt and continue to stay in business, and convenience stores will continue to sell other products, ice cream, candy, and chips, but our generation cannot continue to buy nicotine products without incurring serious health and social effects. My peers and I with the Mystic Valley have done all that we can do to help with substance abuse in our communities. I am 16 and I spend my time fighting for this because it's something that we care about. But now the responsibility falls on you all as adults. We have done all that we can. We've worked to the extent that we can. You need to pass this legislation to save our lives. Thank you.
Thank you.
Thank you. Next person is Cynthia Matthew.
Thank you. I'm Cynthia Matthew, Reading resident. I just heard about this like 6:45. this evening. Didn't realize this was up. This was an issue. So it's quite easy. It's unconstitutional to take our rights away. We have every right to, people drink. I mean, when I was 5 years old, I almost lost both my parents from a drunk driver. Are we doing anything? Are we taking away alcohol? I'm sure many of you drink your beers and your wine. So, you're gonna take that away? And when does it end? I mean, once you start taking our rights away, then this is just one thing. I mean, they've already taken our raw milk away. Raw milk is much healthier for you than, conventional milk. So I'm not a smoker. I hated smoking. I've raised 2 girls, and ever since they were little, I embedded in them that smoking, drugs, any of that stuff is bad. And you want to, your body is, God's vessel, and you want to take care of it. I think more what we should be concerned about is Monsanto's spraying all of our food. And that's what's getting us sick. That's what's causing us a lot of cancer. There's so many lobbyists that keep allowing Monsanto to spray our crops. So I'm not a smoker. I've always hated smoking, but you can't take people's choices away, and you can't take our rights away. That's all I have to say.
Thank you. And then the next name is Tim Matthew. Oh dear.
Maybe I should have taken this in a room. Thanks for giving me this opportunity. I'm not a smoker. I'm not here to endorse smoking. I think it's a disgusting habit. There's appalling statistics that have been shared. I'm a vendor to the National Cancer Institute, so I'm well aware of its terrible disease that comes as a result of smoking. My concern is more so associated with the slippery slope that other people have shared. The board would be pleased to know that today I actually bought a bike. Right, so that's a good thing, but like a lot of people, I considered buying a bike in New Hampshire, just like people in Reading will concern them who want tobacco will think about going to another community, and there's a risk with that. I think what you have in mind has the best of intentions. A lot of people have given you ideas which back up why it's, has some sense to it, but I think prohibition has delivered spotty results. The prohibition era was a failure. There's 80 counties in the United States that continue to be dry counties. They have some of the highest per capita rates of binge drinking and OUI deaths in the nation. People are going to smoke. We're going to be sending them to other towns. I think that sometimes these people will be in an inebriated state. Kind of a lot of times, I hate to say it, but it goes hand in hand. People love a good butt with a beer. I see that happening. I also see driving around to other towns is just simply increasing the carbon footprint, and even if it's a small matter. And unfortunately, the Commonwealth is sanctioning pot smoking and gambling. In essence, you're battling a culture which is fostering addiction. Give you an example of that. My daughter's a senior at Reading Memorial. She was just asked out on a date by another senior, and he asked, is it okay if he doesn't have a license, can he drive her car, meaning my car? And is it okay if he comes over stoned? Of course, he didn't get a date. What I think that says is that you can't legislate good parenting and education. And I think that ought to be the focus of the community, is really ensuring that our young people truly understand the risks of smoking, and we don't make a decision that impedes on people's rights. So thank you.
Thank you.
Thank you.
And I see the name Chuck D'Andrea on the list, but Mr. D'Andrea, we're having one comment per person. Did you sign up twice?
Did I?
Yeah.
No, I didn't know which one to sign.
Okay.
I still have something else to say if you want to hear it.
Then we have to let everybody
Okay, no,
else.
that's fine,
Okay,
that's fine.
thanks. So next name is Carlo Bacci. coming in from the other room.
Hello, thank you guys. Carlo Bacci, Main Street. I am speaking as a resident. And don't smoke, can't stand smoke. No one in my immediate family smokes. But every Sunday, I went to my grandparents' house, and that's probably why I don't smoke. They smoked at the dinner table, they smoked the whole time we were there, and I couldn't stand it as a young person. And that's probably the reason. My grandfather died of lung cancer. Smoking is bad, water is good, right? This is government overreach, that's all it is, right? I can say what everyone else said, that's all it is government overreach, all right? We're all adults, and it's plain and simple. I mean, I can't, there's enough going on in the world that this is a step in the right direction to maybe battle smoking, but you're taking away our rights. So tomorrow, I think I'll go to CPDC and the building department and say, starting in 2004, you can't paint your house. If you buy your house after 2004, you can never paint your house again. Is that fair? The house value is gonna go down. But let's keep it natural. Let's let the paint chip away. Let's keep it natural. So I'm being facetious, but that's ridiculous. We can't paint our house. We can't pave our driveway. This is all you're doing is taking a right that you shouldn't be taken away. I'm 100% against smoking. I can smell it a mile away, but that's not the point. The point is government overreach. Thank you.
Thank you. And then the last name on the list is Erin Calvo-Bacci. Oh, is there, there's another list? There must, okay, let's see if we can find that while we hear from Ms. Bacci.
Hi, thank you. Erin Calvo-Bacci. I live in Main Street. I also serve as an executive director for the Retail Association of Massachusetts. So in regards to businesses not closing, it did have an impact on them. I don't smoke. I also don't drink. Children engage in risky behavior. We should treat all legal adult products the same. The reason children are getting access to products is there is not a minor in possession law. It is very much legal for me to purchase the products and give it to my children. I would never. I also would never give my children alcohol until they were of legal age. My grandmother smoked up until she died. It wasn't the cigarettes that killed her. I'm sure at some point that would have. It was the alcohol. We really need to be mindful of the steps that we are making. Because, as I said, I don't smoke, I don't drink, because it's my body, my choice. Thank you.
Okay, thank you for alerting us that there was another list. Yeah, so no, Amy Lukowicz?
Yeah, I was on the non-speaking side.
Okay,
non-speaking date, but I think
okay.
some people last week.
There may have been some confusion.
Yeah, no, that's Erin and Cindy, the Cynthia, so Sal Bramante?
That's not what it's speaking.
Okay, okay. Were there others that are here who didn't sign the speaking list who'd like to speak? Okay, 2 additional folks. If you wanna come up, 3, sorry, thank you. Okay, I think we have time for the 3, it's some confusion on the list, so happy to hear from folks. You can just introduce yourself, thank you.
Hey folks, Mark Doxer from Beaver Road. So I don't wanna just reiterate the other things, but I wanna say a few things. One, I commend the board for taking this issue up. I think this is leadership in what the town needs to do in health. It's really important that we deal with this. Number 2, I know I was reading the Brookline decision just to understand how this is viewed, and I appreciate the Brookline folks joining and Western Northeastern. There's a whole discussion in here in the case write-up, talks about how they have previously recognized the ill effects of tobacco use, particularly when it involves minors, as a legitimate municipal health concern, justifying municipal regulation of tobacco products. And that's actually a previous decision from 2022 that they highlight here. The second thing I wanted to highlight was, I did some research just to see what was going on, and I came up with an article in Nature magazine, April of this year, entitled "Smoking Bans Are Coming. What Does the Evidence Say?" And it comes out, and the top part of the headline is, countries are cracking down on tobacco use and vaping. The laws could save thousands of lives and billions of dollars. More specifically, the World Health Organization estimated tobacco use costs the world $1.4 trillion every year in health expenditures and lost productivity. Quote, every tobacco-related illness is adding to the burden on the health system unnecessarily. I see this as an opportunity for this community. I see the only way that this is really going to work is if the communities all band together, which is exactly what's happening. I see that there was leadership from Governor Baker back in 2018, starting with much stricter tobacco regulations. I see that he came out in 2019 at one point and actually created a complete ban on vaping until we could get rid of some of the flavored and other activities. I strongly support passing these amendments and appreciate your efforts here. Thank you.
Thank you. And
Hi, Linda Snow Doxer, town meeting member, and also on the board of the Reading Coalition for Prevention and Support. First of all, I want to say thank you to all of the people that have stood up here, especially the students, to talk about the reality of the dangers of smoking and the addiction, the risks. Thank you to the Board of Health for having this hearing, because you didn't have to, and it's very much appreciated. I became involved, actually found my public voice in the late 1980s, 90s around the smoking in public places issue. That was my first time speaking ever at a town meeting. Restaurants claimed that if we stopped the smoking in the restaurants, people would stop coming. They didn't stop coming. Now people can taste the food when they go to eat, and we can bring our children and ourselves safely. My uncle was a bartender. He died of secondhand smoke exposure for lung cancer, and another cousin died of thank you. Thank you. Cancer from smoking. And he had stopped smoking, but it was from when he started as a kid, when people didn't know how dangerous it was. Liquor cannot be sold to minors, and when those rules were passed, drunk driving, accidents and fatalities went down. The access to vapes and Juuls, et cetera, as the students pointed out, can be hidden. I see kids driving by me, sitting at lights, vaping. It's scary to me. And pediatricians, I've read articles, pediatricians don't know what to do with the damage that's being caused to their lungs. We don't have the answers. I think that our job, your job, is to help protect our youth, not make money off of them. And I am very grateful for this amendment, for this nicotine-free generation movement, and I fully support this amendment, and I appreciate your hearing our voices. Thank you.
thank you. And the last is the gentleman in the back, you raised your hand. Just come and introduce yourself.
Yeah. Hi, my name is Sanjay Patel. Thank you for allowing me to speak in front of the board. I'm not a smoker, not a drinker, never have. I'm not here to promote the smoking. I'm also thank you to Board of Health for bringing us together today to discuss an issue of great significance that intervenes public health, economic stability, and individual freedoms. We are here to address the proposal to ban the sale of nicotine products to individuals born after 2004. While this proposal is rooted in the noble intention of protecting public health, it is crucial to consider the broader implication it holds. We must also consider the principle of harm, fairness, and equality. A ban targeting those born after 2004 creates a generational divide. effectively discriminating against the younger adults while allowing older individuals to continue purchasing those products. This inconsistency challenges the principle of equal treatment under the law. Adults, regardless of their birth years, should have the right to make informed choices about their consumption habits. Instead of imposing a ban, we should prioritize education and harm reduction strategies that empower individuals to make healthier decisions. Furthermore, we must aware of the potential and unintended consequences. History has shown us the prohibition often leads to risk of the black market and illegal trade. If it is restrict the sale of nicotine products to the specific age group, we risk driving the market underground, where unregulated and potentially dangerous products could multiply. This would not only undermine public health, but also place additional burden on the law enforcement and regulatory agencies. I have 24-year-old daughter and nieces and nephews are 20s and 30s who never smoke, not because of the smoking ban or the town, but with the right education and guidance. And they decided to make the right choice, which is not smoking. It is not a town or smoking ban did that. In conclusion, while the health risks associated with nicotine consumption are well documented and intention behind this proposal is commendable, a ban on the sale nicotine product to individuals born after 2004 is not the answer. Such a measure would harm small business owners, disrupt local economies, and create a host of unintended consequences. Let us focus instead of comprehensive education and harm reduction strategies that respect individual choices and support the economic vitality of our communities. Thank you for your attention and considering the broader impact of this proposal. I thank you again.
Thank you. If you could just sign in, just so that we have it in your record that you spoke. Thank you. Okay, so unless there is another voice that wishes to be heard, I think that this concludes the
I
testimony.
just wanna make one more point, 10 seconds. A speaker earlier said that, no stores have ever closed because of this. Two did, P&S and JK's closed. Reading Quick Stop is the last standalone convenience store in Reading. Just wanna point that out.
Thank you, Mr. Dorr.
I just want to say one
I'm
last thing.
sorry, I'm gonna be
Most of the people who
Excuse me.
spoke tonight are not
Excuse
even
me.
from Reading, and I hope you'll
Excuse me,
hear
you're out
the
of
Reading
order, I
voices.
haven't recognized you.
I
I'm
don't
sorry.
care. I really don't care.
Excuse me, I really need to,
I don't really care.
I need to allow folks all the opportunity, so that's all. If you,
I had 5 seconds to say, what are you telling me? Yeah, I'm not gonna, you want me to speak or not?
you were shouting at me and
Oh,
I was
sorry.
asking you not to. So if you have something to say, you'd like to approach the podium and share it,
I just say,
I've allowed Mr.
forgive me
Dewar
for,
the
forgive me
opportunity.
for my impoliteness, that wasn't appropriate. I just do, people made a lot of good points tonight, but I was surprised, I didn't realize there would be such a coordinated effort for people outside of Reading to come in. Students, lawyers, doctors, they did a great job of coordinating. I suspect your opinions were made up and on this decision before tonight. I don't think our voices really are I would be surprised if the decision falls in my and others' favor. But I just hope the voices of Reading are heard loud and clear and first. Because I think most of the voices, and Mark and Linda made great points, as did some others, they made great points on the cause for this prohibition. But I think there were more people against it, and I just hope that was understood, because there were a lot of outsiders, and this is the town of Reading. So thank you for giving me time.
Thank you. And there was additional testimony received in writing. We've received a number of letters from and emails that the director has been collecting for us. All of those things are considered in our deliberations. So I think at this time, I'll entertain a motion to close the public hearing.
So moved.
Is there a second?
Second.
Okay, and all in favor? None opposed, passes 4-0, thank you. So the hearing is closed, thank you for coming. I'm gonna invite the select board to adjourn themselves.
All those in favor?
Thank you. Okay. We have nothing else. No, so, motion to adjourn second?
Am I allowed to?
No, we didn't elevate you, so, but.
You second.
Second. Okay, all in favor? Opposed? Wow. Thank you. We are adjourned.